E-health is a broad term, and it refers to generally the use of information and communication technologies to support better health and better healthcare. Has, I think, several objectives in its support of health IT and the development of the electronic health record. So first of all, I think it's the obvious one, which is to develop a shared health record which citizens can sort of take to any healthcare setting that they need to see a healthcare provider in, and have their entire record available so that that doctor or other healthcare provider can provide care based on their complete record and make better decisions for them. So the shared health record is the most visible product of the government's health informatics strategy. But I think also there's other objectives. For instance, the development of the IT sort of the industry around e-health. So people who know how to write these systems, develop these systems, implement these systems. That whole industry. So overall, but the health informatics is really a health initiative. It's not really ultimately an IT initiative. So, and when I say that, what I mean is that it's to create an information infrastructure for healthcare in Hong Kong. So ultimately, the health of our citizens and the practice of our clinicians can all benefit from this shared infrastructure. There's a few challenges that we face in the EHR. So for instance, the technical aspect of actually building this system. Now that's certainly a challenge, but I think the experience that we've had within the hospital authority over the last 2 decades or so will serve us well there, because we've already built up some very large-scale systems within the hospital authority, and now it's a matter of sort of taking that and making it available to the wider population. So that is one challenge, but I don't think the technical challenge is really the most serious one. The other challenges, which perhaps might be even more difficult than that one, are first of all because the hospital authority has already been using electronic records for quite some time now, but in the other settings in Hong Kong, for instance, in the private clinics and the private hospitals in Hong Kong, the electronic records are not quite as well developed. So there's certainly going to be a challenge in sort of promulgating this technology to the other, as we call them, healthcare stakeholders in Hong Kong, particularly the smaller practices who don't have much experience or technical know-how, shall we say, to use these sorts of systems. So that's certainly one challenge. And another challenge is how do we set the privacy aspects of this system. So privacy and security are, I think, of the utmost importance in a project of this nature. Health records are obviously very sensitive things, yet we do want them to be shared appropriately when a citizen needs to seek healthcare. We need to find a way that people are happy with the degree of records sharing, yet it still manages to protect their privacy as much as possible. And I think that's going to be perhaps the key challenge. How can we set the rules, the protocols for allowing this to happen, and then build the technologies to support it? Ultimately, the real test, the litmus test, as it were, is how citizens take up this technology. We're not making the electronic health record compulsory or mandatory in any way. It's going to be we call it an opt-in model, so it's voluntary for citizens and providers to join. So, how do we get the message out that this is, a compelling system for them to take up? So the adoption rate, especially I think by the citizenry, is going to be the key for us. The authority has really been a pioneer in this area, actually not just in Hong Kong, but on the sort of scales that we're talking about. The hospital authority is one of the leaders in the world. So, so today, for instance, we already have electronic records, and a lot of the processes of healthcare are already managed electronically across the board. So, in all of our hospitals, all of our clinics, the computer has become an essential healthcare tool. And that's that system was developed in-house by our own IT department, and so that we've really taken, the hospital authority has really taken the lead in developing these sorts of technologies, developing the systems. But apart from the systems themselves, I think more importantly is the fact that we've already, through the use of these systems over these years, developed a very large electronic database already of our patients' records. So anybody who's been to the hospital authority in the last 2 decades already has an electronic record which records what the results have been, how the diseases have progressed, and what treatments they've received, all that sort of thing. So within the hospital authority, your doctor already has access to your complete history, and he can make better decisions about your healthcare based on that. So we have the systems, we have the actual records themselves, but also I think something which the hospital authority has done over the years of using the systems is we've essentially trained up a whole generation of doctors who are very familiar with using e-health, as it were, in their normal day-to-day practice. So these are doctors who are very comfortable using IT, and they understand how it can help their healthcare rather than necessarily being a hindrance, which is a big issue in many places in the world, that doctors have still not really embraced the use of IT. They see it as more of a burden sometimes. The technologies, a lot of those have already been developed, or we will also continue to develop those as part of the electronic health record program, which is currently underway. But I think as you said, the adoption is really the key. How can we get the private doctors, the private hospitals to adopt these sorts of systems? And also, again, as I mentioned before, how do we get citizens to sign up for this record sharing initiative?